Hi, I'm Dr. Ricardo Rodriguez from cosmeticsurg.net. This morning I was answering some questions in our blog, and one of them was from a patient who had had surgery from another physician, and she was asking me how long was the swelling going to last. Well, really after surgery, the internet is not the best place to get your answers to your questions for two reasons. Number one, whoever is answering your question doesn't know what your surgeon did. And secondly, he's not able to evaluate you. Therefore, the best way to get your answers is to talk with your surgeon directly. And your surgeon should be available to you. It is part of the service you get from your surgeon. It's not only the surgery, it's also the post-operative care. Now, if you're not getting an answer from your physician, you should call again. Leave a question with the answering service, but you really should get an answer by the end of the day. And if you don't, you should continue trying until you get an answer from somebody, either a doctor that's covering from him or from a nurse. Personally, I had an experience. My mother had surgery and I couldn't reach a doctor. Imagine me, a physician, I couldn't get in touch with our surgeon. And that really sensitized me to this problem. So from that day on, I give my cell phone number to all my patients. They can reach me day or night, the weekends, whatever, because I know what it is like to be in that position. And you, as a patient, you should never feel like you're going to inconvenience a doctor, or maybe I'm asking a stupid question. Remember, you didn't get a medical degree and you're not a plastic surgeon. You're not going to know the difference between a good question and a bad question. The only person who's going to know that is the surgeon, and he's the one that should make the determination. This is especially easy now with the new cell phones. I have a cell phone that I can reach right away, and if I have a question, I can tell the patient, look, take a picture and send it to me on an email. It's very easy. I retrieve it under the messages. And for example, I have a picture here from a patient that the patient just sent me this morning. I was able to look, answer her question, and make an appropriate disposition. Now granted, if I didn't have enough information from the picture and talking with her, I would have no question about either meeting her in the emergency room or seeing her in my office or telling her I can see you tomorrow before surgery. The point is that the decision is made after surgery, after an adequate exchange of information. Now, when you are choosing your surgeon, it's extremely important to know what kind of access you're going to have to the surgeon after surgery. And the time to determine that is before you're going to have the surgery. The worst thing is to be after surgery, trying to get a hold of your surgeon, and you either get a nurse or a doctor that doesn't know you answering your questions. So be very specific in your interview with your plastic surgeon. Am I going to be able to reach you personally? Am I going to be able to reach you the same day? And if you don't get a clear answer or he's being evasive, you should really factor that into your consideration as to who is going to be your surgeon. Like I said, I give personal access on my cell phone to all my patients, and I think you should demand the same of your surgeon. Thank you very much for listening to our blog, and we'll see you on the next time.